you don't know anyone's story. And my story is a unique one, but every individual story is unique. I didn't know that I had Crohn's until I was 35 years old. And I would battle these challenges with digestion and stomach pains from being about 6 years old up until I was finally diagnosed. But I didn't realize it was a disease. And I managed this through college, even sleeping in a tub because my body would feel like it was on fire and I would have these cramping pains. And you have to still get up every single day and perform at life. I had stomach aches consistently almost every single day for 2 years by the time I had gotten to diagnosis. And I tried to hide it from everybody because I was so used to going through these pains and performing and being resilient and having fortitude. But there came a point where I couldn't hide it anymore because of my husband hearing every day that I don't feel well. I don't feel well. I'm going to sleep and not feeling well. The physician said that he didn't see anything, but that he would do blood work. After I explained all these other symptoms I was having, from headaches to nausea, feeling like I had to vomit every time I used the bathroom, the sweating, the shaking, all of these things I was sharing, didn't hear from him. And this day I woke up and I could barely lift my head. A friend called me and it led me to actually go to the emergency room. When you get to the point of saying, I'm gonna get down to the bottom of this, because I know it's not normal to have stomach aches for 2 years and the doctor is not responding to that. You're challenged with, do I choose going to all of these appointments to investigate your health? Or do I say, you know what, I have to be at work, I'll deal with that later. And a lot of times when you're not getting answers consistently, that's what we subscribe to. I will deal with that later. You are worthy of more. Demand your answers. Where are the answers? At one point I wasn't committed. I was just following whatever the doctor said and just going with it and checking off the box. I went to a doctor, check. I told them what was going on, check. I got no answers, check. And that was okay. It got to a point that it was not okay anymore. I believe that it was hard for me to be diagnosed because I'm a person of color. It wasn't based on patient wellness. It wasn't based on looking at me as an individual, seeing that this is what she's been presented with. This is the severity of her disease. A lot of times patients don't know what they can ask, what they can say, what they can require from their physician, so it makes them shy away, and there's this battle of the inferior versus the superior. When it comes to Black and Brown communities, we're always told to respect authority, like that's really ingrained in us, but we don't always challenge the authority, and challenge isn't negative. And we have this concept that if I challenge, that means that I don't believe you and then I'm gonna be punished. I think the keys to functioning and living your best life is connection, community, and education. Look, search, talk about what you're going through, and you never know where that'll spark connection to something that will be willing to serve you. I also want to encourage people to share their story, because wherever there's a gap, wherever there's a challenge, there's someone that's going to hear that, and it's going to incline them to contact you or incline them to help you. Today, I know that I have a disease and I'm thriving. I have life now, and I can do things on my own terms and not be subjected to a space that only people can come to me in, like my bedroom or the bathroom. I deserve that. It's not easy, but you're worth it. I want you to choose life, because the moment you stop choosing life is the moment you die. You have to choose life. Alone, I am disruptive, but together, we are unstoppable.